Good afternoon. I am John Kelly, publisher of the Orlando Medical News. Today we are blessed to visit with Dr. Moin Kola. He is a gastroenterologist practicing medicine in Orlando, Florida at the Digestive and Liver Center of Florida. Dr. Kola is board certified in gastroenterology services. He has practiced, as I said before, for 10 years. He completed his gastroenterology fellowship at Case Western Reserve University and the Inflammatory Bowel Fellowship with Crohn's and Colitis Foundation of America at the Cleveland Clinic. Dr. Kola served as chief fellow during the last year of his fellowship training. Dr. Kola began his gastroenterology training in England and holds the distinction of being a member of the Royal College of Physicians of the United Kingdom. Dr. Kola was actively involved in clinical and basic science research during the course of his fellowship. He has published his work in the national and international peer review, gastroenterology, and hepatology journals. Dr. Kola has expertise including colon cancer screening, gastroesophageal reflux disease, peptic ulcer disease, inflammatory bowel disease, celiac disease, irritable bowel syndrome, fatty liver disease, and various other gastroenterology and liver disorders. Dr. Kola is a member of the American College of Gastroenterology and American Society of Gastrointestinology Endoscopy. Welcome, Dr. Kola.
Thank you, John. Good to be with you.
Dr. Kola, please explain to me what colon cancer is.
Colon cancer is a cancer located in the colon, which is the lower or the terminal part of the digestive tract. It typically starts off as a small little lump called a polyp, which grows over a period of time and switches its biological behavior from being benign to malignant, meaning it becomes cancerous over a period of time, and that is what's called as colon cancer.
Who needs the colon cancer screening, and at what age should they begin testing?
Typically, the screening for colon cancer starts at the age of 50 years, except in African Americans who are recommended to start their screening at the age of 45.
Are there different options for colon cancer screening available?
There are certainly different options for colon cancer screening available. The most preferred option or the gold standard for colon cancer screening is colonoscopy. The other options for colon cancer screening are stool tests, a flexible sigmoidoscopy, which is a brief version of colonoscopy, and a scanning method or a scanning technique called virtual colonoscopy or CT colonoscopy. So these are essentially the options for screening for colon cancer.
Now, over the last few years, there's been a buzz in the market about virtual colonoscopies. Do you have an opinion about those?
Sure. It is certainly one of the options, but not the preferred option for colon cancer screening. What essentially a virtual colonoscopy is it's a radiological technique, meaning a CT scan machine is used to take the picture of the colon, which is then programmed by a computer programmer and is converted into a 2 and 3D virtual images of the colon, which is then downloaded onto a computer program that can be seen and visualized by a doctor to see if they have any polyps or cancer in the colon.
But it stops there, whereas with a traditional colonoscopy, the doctor can manage to a solution immediately?
Yes, of course. With the CT colonoscopy or a virtual colonoscopy, you only have the option to be able to look at the images of the colon. With the actual colonoscopy, you are within the colon of an individual where you're able to deal with the polyp, meaning you're able to biopsy and remove the polyp at the same time. So it's a one-stop procedure for colon cancer screening.
And over the last few years, there's been a big advertising campaign regarding Cologuard. Would that be the stool sample that you had mentioned earlier?
Yes, it is. So Cologuard is a new kid on the block as far as the stool testing is concerned. What it is, it's a combination of two tests in one. So the main component or the main factor we are looking for in the stool sample with the Cologuard are tiny little fragments of DNA which are shed in the stools from polyps or cancers. So the Cologuard essentially tests or detects those tiny little RNA, which tells us that a person or an individual may have a colon cancer or polyp. So if that test turns out to be positive, then the next step would be to do a traditional colonoscopy to look for potential cancer or a polyp.
Can you share any type of statistics in this country specific to the prevalence of colon cancer?
Sure. Overall, colon cancer is the third more common cancer in males and females combined, and it's the second most common cause of cancer death in this country.
That is a very large number when you think about percentages. What is your recommendation? How often should individuals in this country be tested for colon cancer?
That's a very good question, John. It all depends on several factors which determines the interval between colonoscopy or any other modality of screening that you may choose. So let's talk about the colonoscopy. As I mentioned earlier, in an average risk population without any history of colon cancer in the family, you typically start screening at the age of 50 years. Now, if that first colonoscopy, which we call as index colonoscopy, turns out to be negative, meaning if that colonoscopy does not reveal any polyp or cancer, then the following colonoscopy is typically in 10 years. Now, if the first colonoscopy shows polyps, then the second colonoscopy or the follow-up colonoscopy or the interval colonoscopy depends on number of factors, meaning how many polyps were found on the first colonoscopy, what were the size of those polyps, and what did the microscopy, meaning pathology of that polyp, show. So there are clear indications or recommendations which tells us how often the colonoscopy should be depending on the findings of the preceding colonoscopy.
I know that a lot of Americans were go, 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 busy, 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 and we forsake our health. But I experienced a colonoscopy with one of your peers, Dr. Sheila. And can you talk a little bit about the preparation and, more importantly, the time it takes to have a colonoscopy? Because my experience, except for the preparation, was I was in and out, and I was sitting at a restaurant eating by the time Elizabeth came to see how I was doing. How long does a colonoscopy take? And tell us a little bit about preparation the day before.
Yeah, of course. John, as you mentioned, there are two components to the colonoscopy. The first component is the bowel preparation that you undergo the day before, and the second component is the actual procedure in itself. So let's talk about the bowel preparation the day before colonoscopy. So the day before colonoscopy, you will be asked not to eat any solid food. You will stay on clear liquid diet all day, and we will encourage you to drink a lot of fluids the day before. In the evening of the day before the colonoscopy, you will be asked to take a bowel cleansing solution, which will clean your colon so that the doctor is able to do a good examination. So with the bowel prep, you'll have several bowel movements to the extent that all your colon will be clean. On the day of the colonoscopy, you will be asked to come to the surgery center on empty stomach, meaning without any food or any liquid that particular morning. You'll be coming to the endoscopy center fasting. Typically, you will undergo sedation by an anesthesia team. You'll be lying on your left side with your knees drawn towards your chest. The colonoscope, which is basically a tiny camera that is mounted on a long tube, is introduced into the rectum, and it is advanced throughout the length of your colon. air or carbon dioxide will be introduced to insufflate your colon to obtain a good view of your colon. If a polyp is encountered during the procedure, it will be typically removed and sent off to the pathology to be examined under the microscope to decide about the nature of the polyp. And the procedure itself typically lasts about 30 minutes. The recovery time after procedure is pretty short. You will wake up typically within 10 to 15 minutes. You will feel bloated for a few hours after the procedure because of the air that we use to insufflate your colon, which you will pass over the 2 to 3 hours. And typically, we will expect you to return back to normal and eating normally within an hour or two once you're up and awake. Does it sound like the experience you had with your colonoscopy, John?
I totally agree. The day before was a real challenge, but the day of, I got to sleep late, got some rest, and had a nice meal within an hour of waking up. And I cannot share how professionally I was treated by your staff. It just was an awesome experience. Any final comments? And then I want to also share how our audience can reach out and get in touch with you if they have additional questions or want to seek your service, doctor.
Yes, of course. As I mentioned earlier, colon cancer is one of the few cancers that can be, number one, prevented, and number two, detected early and treated successfully to obtain a complete remission. It's the third most common cause of cancers in men and women combined in the US, in this country, and the second most leading cause of cancer death. So since it's a cancer that can be prevented or indeed diagnosed early, it's vitally important that every person should seek medical attention to undergo one or the other forms of screening, bearing in mind that the colonoscopy is the most preferred method of choice for screening for this cancer.
Well, thank you, doctor. And how can our audience reach you?
Yeah, there are a couple of ways they can reach us. They can certainly visit our website, which is dlcfl.com. And they are certainly welcome to call us at 407-384-7388. And we'll be very happy to take their questions and answer their questions.
Dr. Kola, we cannot thank you enough. This is fantastic information. We cannot wait to share it with our Central Florida and North Central audience. Thank you very much, doctor, and have a great day.
It was a pleasure, John. Thank you for doing this.